There is something that quietly changes inside your body after the age of 60. And most people never notice it. The same pill you've been taking every morning for years. The same medication your doctor prescribed a decade ago. The same tablet you've trusted without ever questioning. May not affect your body the way it once did. Not because the medication changed, but because your body did. Your heart works differently. Your kidneys filter more slowly. Your liver processes medicine at a different speed. Your blood vessels become less flexible. And these silent changes can completely alter how certain medications behave inside your body. What makes this especially concerning is that you usually don't feel anything at first. No pain, no warning, no obvious symptoms. Just a gradual shift that, over months or even years, may increase the risk of serious cardiovascular problems, like a heart attack or stroke. Today's video isn't about creating fear. It's about understanding something that millions of adults over 60 are never told, because one of the medications we're about to discuss is taken every single day by millions of people. Yet very few ever ask whether it's still the right choice for them. Stay with me until the very end, because the sixth medication surprises almost everyone. And according to newer medical guidance, it's one that many older adults should regularly review with their healthcare provider. Before we talk about the medications themselves, you first need to understand something far more important. A medication doesn't work in isolation. It works together with your body. And after 60, your body begins changing in ways that most people cannot see. Your kidneys gradually lose some of their filtering ability. That means medications may remain in your bloodstream longer than they did 20 years ago. Your liver also becomes less efficient at breaking down many drugs. Instead of leaving your body quickly, some medications slowly accumulate. A dose that once worked perfectly may now produce a much stronger effect. At the same time, your arteries naturally become stiffer. Blood pressure becomes more sensitive. The balance between clotting and bleeding changes. Even mild dehydration, or a small increase in blood pressure, can place much greater stress on the cardiovascular system than it did when you were younger. This doesn't mean medications suddenly become dangerous. It means they sometimes need to be re-evaluated as your body changes. That's why doctors often recommend reviewing long-term medications regularly after age 60. Not because the prescription was wrong, but because your body today isn't the same body that first received it. Now, let's look at the first medication. Millions of older adults take medications like ibuprofen or naproxen for arthritis, joint pain, or back pain. And for many people, they work extremely well. The pain improves, movement becomes easier, life feels more comfortable. But inside the body, another process begins. These medications reduce inflammation by blocking certain natural chemicals. Unfortunately, those same chemicals also help protect blood flow to the kidneys and blood vessels. When they're blocked repeatedly, the kidneys may begin holding onto more salt and water. Blood pressure can slowly rise. Extra fluid increases the workload placed on the heart. Now imagine this happening every day, inside an aging cardiovascular system that's already working harder than before. You won't feel your blood pressure increasing. You won't notice the added strain on your arteries. But over time, that extra workload matters, especially for people who already have high blood pressure, heart disease, or kidney problems. That doesn't mean these medications are bad. Sometimes they're absolutely necessary. But long-term daily use should always be reviewed with your healthcare provider. Now let's talk about something completely different. Heartburn medications, drugs like omeprazole, pantoprazole, and esomeprazole. Many people begin taking them for acid reflux, stomach irritation, or ulcers. The problem isn't usually taking them for a few weeks. The concern begins when months quietly turn into years. Because stomach acid isn't just there to cause heartburn, it also helps your body absorb important nutrients like magnesium, calcium, and vitamin B12. Over long periods, reduced absorption of these nutrients may affect normal muscle function, heart rhythm, and blood vessel health. And that's only the beginning. In the next section, we'll look at 4 more medications, including one that millions of adults take every single morning, believing it's protecting their heart. When for some people over 60, new research suggests the balance of benefits and risks may have changed. Now let's move to something that surprises many people, because it doesn't seem connected to heart health at all. Sleep medications, anti-anxiety medications, drugs like lorazepam, diazepam, alprazolam, and similar medications. Millions of older adults rely on them every night. And for good reason. They reduce anxiety, help with sleep, and can significantly improve quality of life. But here's what most people never hear. After 60, these medications stay inside your body much longer than they used to. Your liver breaks them down more slowly. Your kidneys remove them more gradually. That means yesterday's dose may still be affecting your body today. Over time, this creates a subtle but important problem. People become less physically active. They move less, walk less, exercise less, and circulation begins slowing down. Now imagine blood moving more slowly through arteries that are already becoming stiffer with age. The cardiovascular system has to work harder. There's another concern. These medications can reduce breathing during sleep, especially in people with undiagnosed sleep apnea. Small drops in oxygen, repeated hundreds of times every night, place extra stress on the heart. You probably won't wake up noticing it. But your cardiovascular system certainly does. This doesn't mean these medications should never be used. Many people genuinely need them. But after 60, it's worth asking one simple question. Do I still need the same dose I was taking years ago? Sometimes the answer changes. Now here's one that catches people completely off guard. Cold medicine. Many over-the-counter cold and flu products contain ingredients like pseudoephedrine. People take them for congestion. Blocked sinuses, seasonal allergies. They clear the nose quickly, which makes them feel harmless. But here's what they're actually doing. They shrink blood vessels. That's exactly how congestion improves. Smaller blood vessels inside the nose reduce swelling. The problem is, those blood vessels aren't only inside your nose. The medication affects blood vessels throughout the body, including those connected to your heart. When blood vessels tighten, blood pressure rises. Your heart has to pump harder. Heart rate may increase. Now think about someone who's 65, already has mild hypertension, takes medication for cholesterol, and maybe another pill for arthritis. Adding a decongestant on top may create more cardiovascular stress than expected. Most people never think about medication combinations. But doctors do, because sometimes it's not one medication that creates risk, it's several medications quietly working together. And this becomes more common every year after 60. The fifth medication is often prescribed to help people breathe easier, reduce inflammation, or control autoimmune diseases. These are corticosteroids. Examples include prednisone and similar medications. When used for short periods, they can be life-saving. They reduce dangerous inflammation quickly. Sometimes they're absolutely necessary. But long-term use tells a different story. Steroids influence nearly every organ system inside the body. Blood sugar begins rising, blood pressure may increase, fluid retention becomes more common, the heart suddenly has more work to do. At the same time, cholesterol levels may change, body fat distribution changes, muscle mass gradually declines. Over months, sometimes years. These changes quietly increase cardiovascular strain. Again, this isn't a reason to stop treatment. Many people truly need these medications. The important message is something different. If you've been taking steroids for a long time, regular medical review becomes extremely important. Sometimes the lowest effective dose, or an alternative treatment, can make a significant difference. So far, we've talked about pain relievers, acid reflux medications, sleep medications, cold medicines, and steroids. Each one works differently. Each one has legitimate medical uses. But they all share something in common. The body you have today is not the body you had 20 years ago, and that changes everything. But now, we've reached the medication that surprises almost everyone. For decades, millions believed it was one of the best ways to protect the heart. Doctors prescribed it, families recommended it, people took it every morning without question. But newer research has completely changed how many experts think about it. And if you are over 60, this final medication may be the most important one to discuss with your healthcare provider. Now we've reached the medication that surprises almost everyone. For decades, millions of adults believed taking one small aspirin every morning was one of the best things they could do for their heart. It became a daily habit. Many people never questioned it. Some even started taking it without ever asking a doctor. After all, it was often called a heart-protecting pill. But medicine changes as new evidence emerges, and over the past several years, our understanding of aspirin has changed dramatically. Here's why. Aspirin works by making blood platelets less likely to stick together. That's helpful because many heart attacks and certain strokes happen when a blood clot suddenly blocks an artery. By reducing clot formation, aspirin can lower that risk in some people. But here's what most people don't realise. Your body needs clotting for another reason. It protects you from bleeding. Every tiny injury inside your body, every small blood vessel, depends on a delicate balance between clotting and bleeding. After 60, that balance naturally becomes more fragile. Blood vessels become thinner. The stomach lining becomes more sensitive. Even tiny areas of irritation can bleed more easily. Now imagine taking aspirin every single day, year after year, without ever reviewing whether you still need it. The medication continues reducing clot formation, but your body's ability to tolerate bleeding gradually decreases. That's where the balance begins to shift. Today, many cardiology guidelines recommend something very important for people who have already had a heart attack, a stroke, or certain cardiovascular conditions. Daily aspirin may still provide important protection, but for many healthy adults over 60 who have never experienced a cardiovascular event, the routine use of aspirin is no longer automatically recommended. Why? Because in some people, the increased risk of serious bleeding may outweigh the potential benefit. This is exactly why medical decisions should never be based on age alone. They should be based on your personal risk profile. One person's life-saving medication may be unnecessary for someone else, and that's why regular conversations with your healthcare provider are so important. Now, after hearing all 6 medications, some people may wonder, should I stop taking my medicine? The answer is no, never stop a prescribed medication on your own. That's not what this video is about. The goal isn't fear. The goal is awareness. Instead, there are 4 simple things you can do that may have a much bigger impact than people realise. Number 1, review your medications every year, not just when something goes wrong. Ask your doctor, do I still need this medication? Is this still the right dose for my age? Sometimes, nothing needs to change, but sometimes, small adjustments can significantly reduce risk. Number 2, tell your doctor about every medication you take, including vitamins, herbal supplements, pain relievers, sleep aids, and over-the-counter cold medicines. Many medication problems don't come from one pill. They come from several medications interacting together. Number 3, pay attention to small changes. People often wait until something feels serious, but the body usually whispers. Before it screams, notice increasing fatigue, unexplained dizziness, shortness of breath, swollen ankles, rising blood pressure, irregular heartbeat. These changes don't automatically mean something is wrong, but they deserve attention. Number 4, remember that your body changes with age. What worked perfectly at 50 may need adjustment at 65 or 75. That's completely normal. Good medicine isn't about taking more medications. Sometimes, it's about making sure the medications you already take still match the body you have today. If there's one thing I hope you remember from today's video, it's this. The real risk isn't simply taking medication. The real risk is assuming your body never changes. Because it does, quietly, gradually, every single year. The good news is that knowledge gives you control. One conversation with your healthcare provider, one medication review, one small adjustment could make a meaningful difference in your long-term health. And that's why awareness matters so much, not because it creates fear, but because it helps you make better decisions. If you found today's video helpful, share it with someone over 60, a family member, a friend, a neighbour. Because sometimes, the most important health advice isn't about starting something new. It's about taking a closer look at something you've been doing for years. And if you want more evidence-based videos about healthy aging, heart health, brain health, and living well after 60, don't forget to subscribe. Thank you for watching. Stay healthy, stay informed, and I'll see you in the next video.